Welcome to CareSmarts 360 on Air, a home care podcast. I'm Erin Kell, account executive at CareSmarts 360. While home health aides provide in-home care, chronic care specialists remotely monitor and manage long-term conditions like diabetes or heart disease. By working together, they can bridge the gap. Home health aides can report the senior's vitals and medication adherence to the specialists, who can then adjust treatment plans or raise red flags with doctors. This communication loop keeps the elderly healthier and avoids unnecessary hospital visits. Further, home health agencies can expand their services by offering chronic care management programs, while chronic care providers gain a valuable in-home resource to enhance elderly well-being. It's a win-win for both sides, and most importantly, for the seniors who rely on them. Today, we have Karen Gomes, the owner and founder of RN Answers LLC, on the panel. Karen provides home health and hospice organizations executive level services, including leadership, mentoring, and coaching, board development, strategic planning, and program development. Welcome to the podcast, Karen.
Thanks, Erin. Great to be here.
So we'll jump right into it. Can you explain the different types of home health and hospice services available?
Sure. Well, I think many of your clients are what we would kind of think about in terms of supportive care. So it's non-medical, but they offer really important services to, elderly people in particular, but anyone who needs a helping hand at home to help them remain at home. That can be really long-term service. Sometimes it's partially covered by state funds. Sometimes it's private duty. But, they do everything from helping with meals, with mobility, with bathing and dressing, all of those kind of supportive activities of daily living that people sometimes struggle with. And without that supportive in-home care, people may end up in a nursing home. Then there are skilled levels of home care as well. And those typically don't last long term, but they're ordered by a physician to address a more specific, sometimes short-term issue, but sometimes longer term as well. So if an elder is in the hospital, say with an acute exacerbation of a condition, they may be discharged home with skilled home care, and a nurse and typically a physical therapist or occupational therapist will evaluate them in their home, make recommendations for new equipment, review all of their medications, do a lot of teaching, and just kind of assess to make sure that they are stable after their hospitalization. Sometimes patients may have had surgery and they need wound care and that sort of thing. All of that is covered by skilled home health. That is typically paid for by Medicare or by other private insurance. And then the other really big component of in-home care is hospice care. Most, if not, I would say it's probably close to 90% of hospice care delivery is delivered in patients' individual private homes rather than in hospice facilities. And hospice is a service for people whose expected life expectancy is 6 months or less. So in order to qualify for hospice, a doctor has to deem the patient as someone who has, that shorter window remaining in their lives. And basically, the goal of hospice is not to cure or prolong their illness, but instead to, help them achieve the best quality of life that they can for the time that they have remaining. And they will often, both skilled home health and hospice will often partner with supportive care agencies to really kind of provide that wraparound level of care that's needed to keep people, safe and at home.
Right. And how do you assess an elderly's needs to ensure they receive the most appropriate level of care, whether it's home health or hospice?
Yeah, well, quite often a physician needs to be involved because both of those levels of care do require a physician order in order to be able to, really or to prescribe the home care or the hospice. However, family members or supportive care aides can be really alert for changes in condition. And I think that that's super important. And that's one thing I think that our home care aides out in the community do a great job with. They know their clients really well, and they recognize if somebody's acting a little bit differently than normal, or they just don't have the get up and go that they would normally have, or maybe they're getting really confused. And for them to be able to report those observations, typically, if they're working in an agency, it would go to like a nurse supervisor who would then probably make arrangements to go visit the patient in the home and or call the patient's PCP and arrange for the patient to be seen in the doctor's office. That can really help avoid that ED visit in the middle of the night or that hospitalization entirely. You don't have to have been hospitalized in order to get skilled home care. So if an aide in a supportive care situation notices a change or a problem and reports it promptly, oftentimes a home health visit can be ordered, through skilled home care and just avoid that hospitalization altogether.
Right. And how can families navigate the cost of home health and hospice care?
Yeah, it's really very challenging. I think you have to look at it holistically. If you're not at home, you're going to be paying, a lot of money for assisted living or nursing home care. So if there are funds in the home and the home is, physically supportive for the patient, for the client, and they really want to stay there, sometimes it's worth spending the money on aides to help, rather than making someone move out of their cherished home and have to pay a lot of money in a facility. There are programs depending on state that you live in, and depending on the income level of the individual. So if the individual doesn't have a lot of assets, sometimes they qualify, particularly if their condition is such that they would qualify for a nursing home stay under Medicaid. Many states have programs where they would rather have the patient stay at home, and they'll use some of the money that would go to the nursing home to pay for in-home care. In terms of skilled home care and hospice care, that is typically pretty much 100% covered by the elder's insurance. However, they're not long-term solutions. So, it can be challenging. It may seem, with an elder who's been hospitalized, whose discharge plan is home, and they get ordered all of these great services that, are there in the beginning, but after, say, a month or 2 months, they have to discharge. And if there isn't a long-term plan and, family members or friends available to help, and if that elder still needs support, they're really going to need the care of a supportive care agency. And that can be challenging from a financial perspective.
Absolutely. In what ways can providers of home health and hospice partner for success?
Well, some of the best agencies that I've ever been involved with have had both home health and hospice components, and I think it's becoming even more common. The fact is that seniors in our communities are often they fall within a continuum of care, and their care needs change over time. And it's great if you have the ability to offer a variety of services to meet the patient's needs at the right time, at the right level of care, for their needs in the moment. And that as their needs change, they can progress, either up or down that continuum and have that real continuity of care of, sometimes even the same aides able to cross over, or nurses that can offer palliative solutions while they're receiving skilled care. And then, assuming, the patient, continues to progress, they may eventually get to a place where they can really benefit, they and their family can really benefit from hospice. So, I think the best ways to partner are to really understand your patients, what their risk factors are, what their goals are, and to really support them and make sure that they are educated about all of the things that they are potentially eligible for and that your own agency can provide them. And that's a great way to maintain a longer term relationship with patients.
Yeah. Can you share some success stories where providers of home health and hospice have partnered?
Oh, sure. I mean, I've overseen some of those myself in my career. I think very typically, an agency providing skilled nursing care is going to have a mix of patients. Some patients are going to be, essentially healthy, and maybe they had a hip replacement and they need some short-term therapy and, some wound care, and then they're fine and they don't need anything further. But a big portion of the home care's patient base is going to be patients with 3+ chronic conditions that, really altogether make it extremely difficult for the patient to manage day to day. They're often impacted with pain, with depression, in addition to really complex treatment plans that they have a hard time doing all the time by themselves. They tend to be in and out of the hospital, sometimes 2-3 times a year. And as these conditions progress over time, what happens is the home health agency may be involved for a time, get them stabilized, discharge, they get called back a few months later, discharged. But over time, you really come to recognize that the patient, is having this progressive decline. It's a trajectory of illness that you can really see, and you can help them kind of grapple with and understand. And as their needs change, if the home health agency has, say, a palliative care nurse practitioner, she can go in there into the home and really work with the patient. What are the things that are particularly difficult for them to deal with from a symptom burden perspective, depending on their illness? And they can really work with them to focus more on symptoms and less on, curing, because there really is no cure for these chronic conditions. And over time, as things go, it's a beautiful synergy of home care professionals working closely with patients and families and bringing that care all together so that they really feel like, it's so much more than a warm handoff, where you're calling some other agency down the road and saying, gee, now it's your turn to take care of this patient. When it's done properly, in a true continuum model within, under one roof, essentially, that patient feels no transition at all. And it's just kind of a seamless, delivery of care through the entire continuum. And that, I think, is what serves our elders the best. So
Yeah.
that's what I
Oh,
like to see.
yeah, absolutely. Well, thank you so much, Karen, for sharing these great insights. I'm sure the audience got in-depth knowledge about how providers of home health and hospice can partner for success. And to you, my wonderful audience, thank you for tuning in. Until the next episode, this is Erin Cal signing off.